Okay, students, good morning. Today we are going to show you the peritoneal reflection in the abdominal model. So, first of all, you can see here the lever on the right upper part of the abdomen. Beneath the lever you can see the stomach, you can see the greater curvature of the stomach here, and lesser curvature you cannot see. You can also see the gallbladder, which is fundus of the gallbladder projecting from the inferior border of the liver. Here you can see the transverse colon, but in front of the transverse colon and behind the anterior abdominal wall, the most superficial structure in the abdominal cavity is the 4-layered curtain like structure, which is called greater omentum. So, greater omentum upper extent is attached on the greater curvature of the stomach. The lower extent of the greater omentum continues here, and if we see where actually the lower extent of the greater omentum goes. So, now we have to look at the inferior extent. So, here you can see that we have removed the small intestine, we have removed the greater omentum, and now we can see that from the transverse colon this structure continues, this white color structure continues and attached to the anterior surface of pancreas. This is called transverse mesocolon. That means, the inferior extent of the greater omentum rolls itself and continues upward between transverse colon and pancreas, and this is named as transverse mesocolon. What happens after that? After attaching to the transverse colon and forming transverse mesocolon, it comes down and then it wraps the 6-meter long intestine and attached to the posterior abdominal wall, and this is called mesentery. So, you can see the peritoneal fold of mesentery here, which actually is holding the 6-meter long small intestine. So, you can see the posterior extent of the mesentery coming from the L2 vertebra and then coming downwards to the sacroiliac joint, and it is holding the 6-meter long intestine. We can also see here, and we want to see what are the viscera lying in supracolic compartment and infracolic compartment. You may ask me why I am using this term. See that we already know that the peritoneum has two parts. One is this part, which is attached to the posterior and anterior abdominal wall, which is called parietal peritoneum, and what we can see now like greater omentum, mesentery, transverse mesocolon, and all the peritoneum lying on the different viscera, that is called visceral peritoneum. So, parietal peritoneum and visceral peritoneum, but remember that the visceral peritoneum, when it attached to the transverse colon, it divides the total abdominal cavity into two compartments. So, even practicing surgeon, they are different. Some surgeon they only operate on supracolic compartment, some surgeon they are only operating in infracolic compartment. So, let us try to see what are the viscera lying in supracolic compartment and infracolic compartment. So, why it is necessary? Because greater omentum and transverse mesocolon divides abdominal cavity into upper part and lower part. So, supracolic compartment starts with liver. If we remove the liver, we get stomach. This is the abdominal part of the esophagus, lesser curvature, greater curvature, fundus, body, pylorus. Okay. And if we now remove the stomach, we get spleen. So, three principal structure again to see in the supracolic compartment is liver, stomach, and after stomach spleen. But please see that there are some structure which are hidden in the supracolic compartment. These are called retroperitoneal structure, which are behind peritoneal cavity. So, this is kidney, suprarenal, second part of the duodenum, pancreas. So, right kidney, left kidney with suprarenal with duodenum and pancreas forms retroperitoneal structure in the supracolic compartment. What about the structures in the infracolic compartment? Small intestine. So, towards the right side is the ileum, towards the left side is the jejunum, small intestine, large intestine, cecum. Beneath cecum here is, you can see the appendix hanging from here. So, this is the ileocecal junction, ascending colon, right colic flexure, transverse colon, left colic flexure, this is descending colon, and this descending colon continue as sigmoid in the pelvic cavity, sigmoid colon, then rectum, anal canal. So, to repeat again, contents in the infracolic compartment, jejunum, ileum, ileocecal orifice, cecum, appendix, ascending colon, right colic flexure, transverse colon, descending colon. Descending colon continue here at the sacroiliac junction, sigmoid colon, rectum, anal canal.